Hello, and welcome to the Nursing Economics podcast series. This series provides extended content relating to articles published in the journal, such as interviews and roundtable discussions. Before we get started, we have a special offer for our listeners. You can save 50% off 1- and 2-year subscriptions to Nursing Economics. Simply visit nursingeconomics.net, click subscribe, and enter promo code NECSAVE50 to take advantage of this special discount. The value of transition to practice programs are well documented in the literature. In this episode, Dr. Syl Trepanier discusses with Ms. Larissa Africa the results of a think tank of national nurse leaders around the topic of transition to practice and how this should be viewed as a strategic investment into the nursing workforce. We are pleased to provide Ms. Africa's interview with Dr. Trepanier.
Hello, everyone. This is Larissa Africa, and I have the pleasure of sitting down with my colleague and friend, Dr. Syl Trepanier, to talk about the value of transition to practice programs. The nursing profession has experienced a great deal of challenges in the last year. The Future of Nursing Report 2020 to 2030 and the Tri-Council COVID-19 response both alluded to the fact that as nurse leaders, we must prepare the nursing workforce for the challenges ahead of us. Transition to practice programs is an intervention that we know positively impact the workforce. Syl, thank you so much for joining me in this podcast. Now, you and I have known each other for more than a decade now, but will you introduce yourself to our listeners and share how you became involved with transition to practice programs?
Absolutely, and so excited to be spending this time with you, Larissa. I currently serve as the System Chief Nursing Officer for Providence St. Joseph Health. This is a healthcare system that's based in Renton, Washington. And in that capacity, I essentially serve as the most senior nurse leader executive for the organization. I feel humbled and blessed to be able to serve in that capacity. We can have as much as 48,000 nurses who practice within our healthcare system. There's 53 acute care hospitals, and we lose count of the number of other places where we actually minister and practice. So it's a great opportunity for me. I've been a CNO now since 2007, and you mentioned that we've known each other for a long time. And when I think about that, when we first met is when I first became a CNO, actually, in 2007. I'll bring you back to the days when I practiced in Florida, as you may remember. And that's been an amazing journey. And I've always had a passion for a transition into practice. It's always been very important to me. I will always remember how I transitioned myself, although I hate to admit it, but it's been 32 years now, by now. But, in 2008, I had a regional role. And this is when you and I started to work a little bit more closely. And that passion really further developed in I entered doctoral work at the time. And that ended up being most of my work that I did, my academic journey, but really translated that into practice and developed a business case internally that really allowed us to really deploy the residency into practice into many, many more acute care hospitals. And I'm really so blessed because that work really has allowed me that work was disseminated, and it really allowed me to be further and further involved in what today has been a bit of a revolution in terms of how we transition nurses into practice today through residencies and the like. So that's been a little bit about my journey.
Thanks for sharing that. It's always so exciting for me when I speak with senior nurse executives, especially one in your position. And you and I have both kind of really grown up with transition to practice programs, and our work has evolved around this. Mm-hmm. So I think our audience would also agree that it's safe to say that with your experience, you're really the best person to speak to the value of transition to practice programs, which we know have been well documented as far as increase in confidence and competence among those who've gone through such a program. Can you share a little bit more about your personal experience with implementing transition to practice programs?
Yeah, absolutely. And I've had experiences developing transition into practice program, enhancing transition to practice program, partnering with outside organization and deploying in a box transition to practice programs. So, I feel I've had the opportunity to see the value into all of the various ways you can embrace this. And everywhere I've been, there's common themes throughout what a residency brings. And I've always been a huge fan. However, I would say that my appreciation for it has just deepened over the years. And so much so that it's known, and I feel it in my heart, I feel it in my bone, that it is the only way to ensure a proper transition into practice and a proper transition into specialty as well. This whole endeavor started with us having a laser focused on transitioning new nurses into practice. And meanwhile, we kept on moving nurses about from one specialty to the next and not really fully embracing the same concept and helping them transition into specialty. And it is as equally important today. We've conducted research over the years that has been demonstrating the impact both on the nurse and the organizational outcomes. You and I have actually had the pleasure of doing many of that work together in multiple different settings, community-based, academic medical center. At the end, it's really hard to refute the evidence that demonstrate its positive impact. So I have personally seen the values. Mm-hmm. I've seen the values in terms of increased competency, increased engagement, decreased turnover. In the organization where I practice right now, the turnover of any nurses that goes through a residency or a fellowship within our organization is between 1/3 and 1/2 of what it is for any other nurses in the organization. That's significant. And in fact, I would say that now what we are trying to figure out is, so those special ingredients that are within the fellowship and the transition to practice program, what's that we need to also make sure that we deploy for the entire workforce? So we all have a lot of work to do in that space. I've seen the impact because of the decrease in turnover, has had the impact in decreasing the reliance on contract labor usage, premium dollars in certain markets. It's clearly an investment. It is not an expense by any stretch of the imagination. And in fact, I have been in many conversations with many CFO colleagues who more and more today articulated the same way. And if there is one thing that I'm getting more and more excited about, is my ability to have inspired and influenced many in flipping that conversation and really seeing it as an investment rather than an expense.
That's really great to hear. When the values that you mentioned, you talked about increased competence, increased engagement, decrease in turnover, decreased reliance in contract labor usage, just to name a few of those values, is really the reasons why the American Academy of Nursing published their policy brief in 2018. And speaking of influencing nursing, in 2019, you and Dr. Pat Yoder-Weiss moderated a national think tank of nurse leaders representing academia and practice to discuss the policy brief that strongly recommends a new graduate transition to practice. Then you conducted a follow-up survey of over 500 AONL members to examine their assumptions and attitudes about these programs. And those findings were published in both Nurse Leader and Nursing Administration Quarterly. Can you share your findings in those studies?
Absolutely. First, Larissa, I have to say that was an amazing opportunity. I thank you for the vote of confidence I remember when you had asked me to do that with Dr. Yoder-Weiss, I had a little bit of imposter syndrome in the moment as you were asking me, like, you want me to do that? I'm glad that I had Pat at my side, because she's been my rock and my mentor and my coach for so many years. So I appreciate and I also want to take a moment to acknowledge Robin Begley and really want to thank her. Robin Begley, for our audience here, is our AHA, our American Hospital Association's chief nursing executive. And she promoted the project. She saw the value into it and really allowed us to engage with AONL members. And I'm forever grateful for her granting us that access. And we had over 500 nurse leaders who responded, which we were tickled to see that. Now, those represent nurse executives, directors, managers, We had residency program leaders and educators who also participated in that survey. The majority of them practiced in urban environment, and about 70% of them reported having a residency program specifically for new graduate nurses that was like in place. 60% of those were homegrown program. And it's great and it concerns me at the same time, because the more homegrown, the more variation, and it decreases our ability to together as a nation, as a profession, demonstrate its impact, because my sense is you've seen one, and it creates a lot of variation. Although today is a little bit different because we do have the ability to have those accredited, and maybe we can talk about that a little bit later in our conversation. So to go back to the survey itself, there is one question that I wish we had asked at the time, which is about the accreditation. We didn't. Well, it's still fairly new, and I can't remember whether we forgot about it or whether we deliberately did not include it in there. I'm not quite sure, but I wish we had asked the question at that time, understanding that the numbers would have been low, but it would have been good to have a baseline of where that began. So we didn't do that. So this is where it gets really interesting. About 30% felt that they had not been able to demonstrate the value of a residency for new graduate nurses. That means that about 150 leaders who responded felt that the senior leaders in their respective organization did not see the value of a residency program. I mean, I still today scratch my head on that one and I want to know more.
Mm-hmm.
I want to know more about that. 88% of them felt that a residency program is important. So here you are, the greater majority of them say, hey, it's super important. And yet they're not able to somehow get their colleagues to be behind it. Now, that still means that 12% of the people who responded to the survey did not, believe in using a residency. And there too, I'd like to show some curiosity and understand that a little bit better. What we found out is that 85%, if I remember correctly, of respondents stated that a structured, standardized nursing residency program either would have or has had a positive impact in their respective organizations. So you could already start to see, at least for those who responded, a movement around wanting to have some sort of structure and standardization around that, which that really I find comforting to see. Most leaders felt and agreed that a new residency program brings value to the organization. They describe it, in fact, I'll quote you something here, as essential to the development of new graduate nurses. And they support the idea that a transition to practice, is a must-have in the organization. So I shared that, nurse leaders shared at the time that they were not in support, though, of a national mandate. So although people feel that it's important and we must have it, we got a lot of caution around a national mandate. If I remember correctly, nurse executives particularly expressed that a mandate would place a burden on healthcare organization and the resources that are required for that. And, the devil is always in the details. So what does that mean to have a national mandate? And that stirred up, quite, some trepidation. So just to round us back, right? So we were doing the survey to see what people would have to say around the position of the American Academy, which was, hey, thou shalt have a residency. And nurse executive says, yes, but
right.
What does that mean? Many of the nurse leaders reported that they were seeking accreditation for their residency program and or had already sought in the past. But many of the nurse leaders identified that, accreditation could be perceived as cost prohibitive. I want to know a little bit more about that as well. I just went through this experience in the system where I'm at today, and we have 13 accredited program. We just finished our session 2 weeks ago, I believe, with ANCC to have over more than 23, I believe, programs that are going to be accredited. Great experience, amazing experience for us. So we're pretty excited. I don't know that it's cost prohibitive to do that. And I would argue, does it cost money? Yes. But what I would argue is that, and here's the return on your investment, and having a standardized program that has the recognition offers all sorts of benefits, which cannot be underscored. There's a lot of financial incentives. So anyone today that would say that it's cost prohibitive to pursue an accreditation, I would welcome a conversation with them. And I feel pretty confident that I'd be able to demonstrate that there is a business case around it. What else can I tell you? I could tell you that there is a portion of the respondent that felt that they were either, the decision makers themselves were seen as unsupportive or neutral to the idea of a residency program. And that was by like 16% of our respondent. So you'd still wonder, right? So what are those factors that are preventing this support? I'm not sure. So we need to keep the conversation going here. And that's why I think that, conversations like the one we're having today, and I'm hopeful that we're talking to an audience that is not necessarily 100% sold yet, right? So that they can further their curiosity and seeing if others are able to implement it, to seek accreditation, and to justify its investment, and to have finance colleagues to see it as an investment. I'd want to know that I'm able to help others in being able to achieve that as well.
Absolutely. Well, so you've given us a lot to think about with that response. But I think I'm going to give the two of us another assignment of further exploring.
There you go.
Maybe another article for us to write about. Why are there still nurse leaders who are not completely bought in to the value of a transition to practice program? One thing that's recently surprising for me is I started hearing some new grads saying that because they had just completed nursing school, that there's no reason for them to go through transition to practice program. I heard that 20 years ago when I first started my journey into nursing, and it's a little bit of a surprise for me that there's still that mentality. So I guess it's not a surprise at all where we do have some nurse leaders who are still unsure of, is this really making a difference? Which is why I agree with you that this conversation needs to continue, and then further explore what can we do to really demonstrate not only the value of having a more competent nurse, but looking at what the investment argument is, right? So even, in my conversations with other colleagues, how do we move from a cost argument to an investment argument? And I heard you say this. I heard you say expense cost prohibitive as you're describing the results of the think tank and the follow-up survey. And I know you and I have had a lot of discussions about transition to practice programs. Really, it's an investment. It's not an expense. And I think I heard you correctly again today, repeated that. So can you expand on that and tell me a little bit more and share with our audience how you move from a cost argument to an investment argument?
Yeah, you heard me correctly. Transition into practice is an investment. It's not an expense. And I really stand by that statement. At the end of the day, I am very clear that our people, our nurses, are the number one asset that any organization has. So our number one asset is our people. It's our nurses. Nurses are at the heart of any clinical care organization. I actually never seen a clinical care organization function without nursing at the heart of it. Without a nurse, you cannot get the revenue that we're obtaining right now. Physician can't access their professional fees if the nurses are not there 24 hours a day in an acute care setting, for example. And people wouldn't have to stay in a hospital setting if they didn't need 24-hour, nursing care. So let's not lose focus of that, right? So it's not a necessary thing. It's a requirement. It's part of the way the business is defined. That's how you can restore people to their initial baseline, if you will, through the help of nurses and the guidance and the support of nursing care. So it's not an expense, but rather an investment that allows us beyond the fact that it allows us to bring back to health or to bring back to their normal, whatever the normal is for any individual, patients, those that we serve. And in the process of doing that, it allows us to generate revenue. It allows us to build healthier communities. Whatever that vision, mission is of any organization, it's at the heart of it. So I always challenge anyone that tells me that it's an expense, because you can talk about the fact that it's an expense when you're looking at it in an unbalanced way. But if you look at what it generates, which is a much more holistic way of looking at it, when we build a business case for anything else, we don't just look at the expense. We look at the return on that investment. We look at what it brings, right? So why for that would we only look at one end of the spectrum and not look at it from a holistic perspective? And in fact, I would tell you that right now, and oftentimes this, I'll open a parentheses first before I go to my other thought. Oftentimes we may find ourselves as nurse leader having spirited conversations with our finance colleagues around, so what's included in that productivity, right? And I'm showing quotes here. So what does that mean? And I've practiced in organizations where education hours towards, that is part of the residency, whether it's productive, non-productive hours. I've had some, people saying it's, non-productive. What the heck does that mean?
Mm-hmm.
Right. At the end of the day. But the reason why I mention this is that all of those hours that are costing us money. I mean, I get that, right? I certainly appreciate that. It translates at the end of the day, and we oftentimes challenge ourselves and benchmarks ourselves as in terms of productivity and what does that mean? And it's all wrapped up in there. And when you see nursing hours as an expense only and not as a factor of generating the revenue, this is where it goes sideways. So I think it's really important that we revisit that we challenge that. And what I was going to say is I've recently gotten a phone call from some colleagues, and I'm excited that there's some conversations on redefining, and should we redefine nursing productivity as we see it today. And I think that conversation is as equally as timely as the one we're having right now, because I think it's going to support further the comment of seeing residency as an investment rather than an expense.
No, absolutely. For many, many years, we're always talking about how do you demonstrate the value of nursing, right? How do you demonstrate the value of what we do as nurses? And you're doing some amazing work, and this is really, really exciting. And I imagine as you're working on a workforce development strategy, you're experienced nurses, and there's a lot of experienced nurses around the country who are rapidly retiring. And that's probably not far from your mind as well. And we know that this anticipated retirement is resulting in predictions of a shortage as well as an experienced complexity gap. Does the transition to practice program play in your strategy to address that within your system?
Oh, absolutely. I mean, it's at the heart of it. My sense is, as we are talking right now, many of my colleagues are finding themselves in probably one of the biggest workforce crises that we've ever found ourselves in. Nurses and healthcare workers are exiting the industry. I read someplace the other day, I forget where I read this, something like there are 9 million jobs available for Americans today, and there are 9 million people on unemployment.
Oh my gosh.
So it's something about a workforce mismatch. The jobs are not where the people are. People moved a lot due to the pandemic and are looking for opportunities in different places and different industries. I mean, there's all sorts of stuff that is ongoing right now, and healthcare is not escaping this pretty difficult time that we find ourselves in. And how does that relate to transition into practice? Well, that means that we have to, and now more than ever, we have to rely and, quite frankly, include new graduate nurses in a workforce plan. And the beauty is you can plan for it, right? So I would argue that every nurse leader should have a pretty robust plan, a workforce plan, and that workforce plan ought to include, and that could be a conversation in it by itself of what the workforce plan could all include. But one light item is definitely transition into practice. It's at the heart of it. And the majority of the nurses who are able to hire today very much fall into that category. So it's crucial. It's important to have a plan like that in place.
Right, absolutely. And going back to your earlier comment of transition to practice, really not only for new graduate nurses, but nurses who are moving into different specialties and new areas of practice, and how much they deserve the same type of support as they make this transition. And your recent comment about workforce mismatch, or just really exploring what else is out there for me as a nurse. So this whole conversation of transition to practice, we can't just focus on new graduate nurses, because how do we help experienced nurses maybe transition into another, not just another specialty area, but another role as a case manager, for example, or somebody who wants to go into long-term care or advance in their degree and become nurse practitioners, and how do we support them as well? So
absolutely.
A lot more work to do in this area. Syl, you've given us so much today. Any just final thoughts or words of wisdom as we end our podcast here?
I would say stay engaged. Stay engaged in the conversation, both locally, regionally, and nationally. I would say do not underestimate the need to invest in a new graduate nurses, that it has to be at the heart of your workforce plan. I would say stay abreast of the science, stay abreast of the literature. When you find roadblocks and you cannot have anyone in your organization remove those roadblocks with you and or for you, find someone that might in your network, find someone that may have, and engage in the conversation to find out how they have been able to do that. Help them help you by asking them to share with you any material that they have, any business case they may have built. Practice your pitch with them. Don't take no for an answer. You may have no the first time around, but just come back to it. Also remember that when you pitch something new, that timing is everything. So you have to make sure that you prepare your audience and that you're very timely about presenting your case. So never take no for an answer. Find the mentors, find the colleagues that can help. I have learned throughout the years that I can attach numbers to anything. And I know that everyone else can, and would encourage everyone to do so.
Those are some great ending to our podcast. Thank you so much again for spending this time with me and our audience. And your message about the value of investing into our workforce is clear, especially as we enter into this new world of post-pandemic era. So thank you again, Syl, and I'm sure you and I will chat soon.
Sounds good. Thanks so much.
Thank you.
The Nursing Economics podcast series is owned and produced by Jannetti Publications, Incorporated, all rights reserved. No portion of this podcast may be used without written permission. Ms. Larissa Africa is president of Versant Healthcare Competency Solutions in Las Vegas, Nevada. Dr. Sylvain Syl Trepanier is the System Chief Nursing Officer at Providence St. Joseph Health in Renton, Washington. For archived episodes of this podcast and to learn more about nursing economics, visit the journal's website at nursingeconomics.net. You can also subscribe to the Nursing Economics podcast on Apple Podcasts, Google Podcasts, Spotify, Stitcher, TuneIn Radio, our hosting site Spreaker, and everywhere podcasts are found. And remember, as a listener, you can save 50% off 1- and 2-year subscriptions to Nursing Economics. Simply visit nursingeconomics.net, click subscribe, and enter promo code NECSAVE50 to take advantage of this special discount.